Dr. Kofi Owusu is also here. He's going to talk about pain management with us pretty shortly. But before then, Shola will read a few tributes that have been pouring in for the 8 gallant men that lost their lives in the line of duty.
Right. We have one more, actually. And this is from Sam George, Honorable Sam George. So we take it. This one says, where do I start? And to whom do I turn? Everyone else is distraught and in despair. How does such tragedy befall a man so calm and warm? How do you leave me and the squad like this? The tears flow even when I try to compose myself. Composure is a distant reality for me as the pain I feel cannot be expressed fully. Kofi, why? How? This is not what we agreed. You always asked me who would take care of your mom if anything were to ever happen to you. What did you know that you had from me? Rita and the kids, who can be there for them like you? Oh, why? No one has been of greater help or support to me in my political career. I call you boss and you call me bro. You didn't just care about my politics, you cared and loved my family. You chose the school for my kids and even asked me every term about their performance. You were not a colleague. You were the elder brother I didn't have. You would call me and admonish me when you... Let's flip it, please. No, this is half of it. As I said, this is from Honorable Sam George. And then he paid his tributes immediately. It happened. Well, this is a continuation. This says, you would call me and admonish me when you saw a social media post of mine. Who would guide me now? You have been my compass and my guiding lights these past 7 months since I was appointed minister, preparing me for cabinet and showing me the ropes. And now who do I turn to? My faith is shaken. My belief is gone. We were told to give thanks in all things, but how can I give thanks in this? How do I say it is well? It is certainly not well. I have questions to ask God, very serious questions. How does this happen? Kofi Owusu, wake up and tell me to activate all body cameras. Call me and say, Jata, you have done your thing again. Just pick your call. Boss, please pick your call. Rosing.
Sometimes you wish you can say, pick your call, and the person will pick their call.
Yeah.
We underestimate, phone calls until the person is no more.
Yeah.
There are times people are calling, oh, why is this person calling me so much? And then it gets to that day where that call never comes in. Sad as it may. But may their souls rest in peace. We are here to speak about pain management, and I'm here with Dr. Kofi Owusu. He is an anesthesiologist and also a pain specialist. Good afternoon, sir.
Good afternoon.
How are you?
I'm good.
Great, and thank you so much for coming in today.
Pleasure.
We had to pull you from the surgical ward right to this place. Yeah. Yes. So you've been doing anesthesia for how long?
Close to about 15 years now.
Wow. When I hear people are into anesthesia, I'm like, whoa, you put people to sleep. What if they don't wake up?
Well, the job is to put them to sleep, make them comfortable, make them safe during the surgery, and wake them up. The last part is very important.
Yeah. So you have to wake them up again?
Yes.
Oh, wow. That's how it works?
That's how it works.
So I didn't know you wake them up. I thought you wake up after a while.
No, I wake them up. When it's done, as surgeon is done, I know what to do to get them back.
Wow.
Breathing, yeah.
Wow. Yeah. Your work is quite tedious, I must say, and a bit daring. So for that, it's like putting somebody to death and raising the dead again. Yeah. Anyway, we want to talk about pain management. We are all in pain one way or the other. Some are going through emotional pain, others are also going through their physical and body pain. And so talking about pain management, we want to talk about pain disorder in particular. What is pain disorder?
Well, pain is a very complex thing. There's not one proper definition. Usually, I will tell my colleagues that pain is whatever the person says pain is. But in simple terms, what I say is pain is like an alarm. It tells our body that there's something wrong that we need to take care of. Just like putting your hands on a hot stove, right? You have pain, you take it out. So pain is something that tells us that there's something wrong that we need to check out.
Right.
Yeah.
And there's a disorder for it?
Yeah, so pain, there are two kinds of pain. There's acute pain.
Okay.
Acute pain is like, you hurt your toe, in about a week it goes away. That is acute pain. But there's also disorders that falls under chronic pain, where you have an injury, the injury goes away, but then 3 weeks, a year, 2 years, 5 years, you're still having the pain, which affects your, quality of life. You are not able to sleep. You're not able to work. You're not able to interact with your colleagues and your friends. You have, mood disorders associated with it. So when it lasts that long, it becomes a disorder. Yeah.
So then, how does it affect our daily lives?
Yeah. So chronic pain just takes the joy away out of your life. Joy out of your life. So if you are if you're not able to live your normal life, not able to interact with family, if you're disabled and not able to work, I think that's very significant. Yeah.
So the chronic pain that we are talking about is like you having a pain that never goes away.
That never goes away. So it is important to see a specialist who can help you manage that or help take it away. Yeah.
It can be managed?
It can be managed.
It can be taken away.
It can be cured, and if it's not curable, it can be managed to an extent where you will still be functional. The goal is to make you restore your function and help you improve your quality of life. Really.
Right. Now, talking about that, as I said, as we are grieving, people are going through emotional pain. Can you say emotional pain is going to be chronic?
Yes. I understand this loss on such a scale is very significant. Obviously, people are going through emotional pain, but it's also important to recognize that there are a lot of us who are going through physical pain because emotional pain can manifest physically.
That's what I was going to ask you.
There are people who are having headaches, chest pain from just grieving, neck pain, back pain.
From grieving?
From grieving, It's very interesting how deeply connected the brain and the body is. So whatever is going in your brain can actually affect you physically. And actually, when it comes to pain, you don't feel pain unless your brain tells you that you're having pain. So it's very, very interconnected, yeah.
Okay.
So definitely emotional distress that we are all going through, if not managed well, can manifest as physical pain. Yeah.
Wow. So in this difficult period, people are crying. It could manifest into headaches. It could manifest into back pain. It could manifest into neck pain. So then when it manifests into that, how do we manage it? Well,
the important thing is not to grieve, is to perpetuate unhealthy grieving, okay? This is a time that you have to allow yourself to grieve, okay? Don't suppress grief. When you suppress grief, that's when it could manifest physically. So it's important to connect with your community, your faith community, talk to your friends. Some people may need to talk to a therapist or a counselor. So that is very important. You get that emotional part out of you so that it doesn't manifest physically. But if it does manifest physically, such as chronic headaches, neck pain, back pain, then you obviously need to see a specialist, a pain specialist, somebody like me, and we have the right interventions to help you recover from that.
So what are the most common pains that we hear from people?
Oh, there's a lot of pain in Ghana. Okay. A lot of pain in Ghana. People just think pain is part of life. Pain is not. It's not normal. Like I said, it's an alarm telling you there's something wrong, so you need to see people. I mean, typically I see middle-aged and above people coming to the hospital. A lot of older people say, no, it's not normal. There's something going on wrong. But mostly, the kind of pain that I see is just back pain, lower back pain, neck pain, and joint pains, mostly in the elderly. But a lot of people do suffer from chronic headaches, okay? Mostly in both men and women, but mostly in females, pelvic pain. And so the perineal area, when you say perineal, is the under part. A lot of people suffer from that. There is also what we call chronic regional pain syndrome, where people do injure, just minor injury to the leg or the arm, but then you become disabled where you are not able to use the limb like you used to, and the appearance of the limb will change. Sometimes you have swelling, sometimes it goes down, sometimes, you know, the temperature of the leg changes. You don't grow hair on the leg anymore. This I see this in the hospital a lot. I think it's widespread, but people just do not know that it's connected to a pain syndrome. Another very important thing that I think is neglected here is, in this country, when I say here, is cancer pain. A lot of people, when people have cancer in this country, I feel like they don't get adequate, you know, pain treatment, and they just suffer until, unfortunately, if they have to pass along, they do pass. But there are a lot of options for cancer-related pain, and it's always important to see a specialist to help you through it.
Is it advisable to be taking painkillers on the regular?
On the regular, no. I mean, when we say painkillers in this country, it's mostly your paracetamols and your ibuprofens. Ibuprofen and other class of medications that we call NSAIDs, so ibuprofen, diclofenac, they do affect your kidneys a lot. And that's probably why we are seeing a steady rise in kidney dysfunction and people are on dialysis a lot in this country. So this happens because people do delay care, right? They do not go see a specialist. They have pain. They're like, oh, meet my with you. No, go see a specialist. If they need to put you on a course of painkillers, they know what dose to give you and how long you need to take it. Sometimes you don't even need medications. There are other things that we can do to your body to help relieve the pain. Yeah.
Right. So apart from painkillers, what are some of the other things you can do to help relieve the pain?
Yeah, a lot of things we can do. We can pain. The sensation pain is picked up by what we call a nerve. So nerves are like wires in your body that picks up the signals, takes it to your spinal cord, takes it to your brain, and your brain has to tell your body that you are in pain, and it just comes down to where you are hurt, okay? So what we can do is we can do what we call a nerve block, where we go in precisely and put that nerve to sleep by injecting some medicine around it. We can inject what we call local anesthetic to put the nerve to sleep, or we can inject steroids to decrease any inflammation around it. There's also something that we call radio frequency ablation, where we go precisely find the nerve that is picking up that pain, and we are able to burn the nerve. I know it's scary when you say you're burning the nerve, but typically the nerve grows back in about 3 to 6 months. So you still have feeling in that area, but hopefully when the feeling comes back, it's not a painful feeling. Sometimes too, we have to use electricity to block the signal of pain going to the brain. So there is an advanced intervention called spinal cord stimulation, okay? It's not present in the West African sub-region, but my clinic, West African Institute for Special Surgery, we are introducing that into Ghana first, by the end of this year. So it's called spinal cord stimulation, where we can put electric signals close to the spinal cord and block any pain signals going to your brain. There are other few things that we can, other interventions that we can do. For cancer pain, there's something called autonomic nerve blocks, where we go down into any part where the cancer is, and we block the nerve that tends to pick up pain signals from the cancer. So there's a lot of things that we can do. That
can be done.
Yeah.
Now, you have been an advocate for pain management for a while. Why so, though?
Because I know in this country, when people are, wealthy, they're able to, and they're in pain, they can fly out of the country, they go to India, South Africa, and get all these fancy interventions. But I know that pain doesn't only affect people who have money or who are wealthy. It affects, it doesn't respect anybody. Pain affects everybody. And I think there's a prevalence of pain in this country. A lot of people just do not know that they have options. When they think about pain, they're just thinking, we're going to take pain tablets or we're going to have surgery. But there's a lot in between those extremes that we can do. That's why I want to create the awareness that, you know, there are options. And when you're in pain, pain is not normal. You shouldn't make it a part of your life. Just come see a specialist and we can help you out.
Right, okay. So you're leaving Ghana very soon, right?
Yes, yes. So I am based here in Ghana and in the United States. I left Ghana over 25 years ago after high school, but my intention was also always to come back home and help treat my people and develop the healthcare here. So I spend about 50% of my time in the United States. I spent 50% here, but I'm slowly, fully transitioning into the country.
All right.
And it's an exciting time in my career.
We can't wait to have you transition into the country. So before you go, anything you want to say?
Yes, I mean, I want to tell people that pain is not normal. Early intervention will prevent long-term morbidity, which is long-term illness. So whenever you have pain, just come see a specialist, and there's a lot of things that we can help you manage your pain to improve your quality of life. Yeah.
Thank you so much, Dr.
Thank you
Kofi
for having
Owusu.
me.